Ian Gibbons went to work every day knowing the machines didn't work. He was a Cambridge-trained scientist, the kind of man who had spent his career caring about whether things were true, and he had told his wife in those exact words that nothing at Theranos was working. The night before he was scheduled to testify under oath and say so in a courtroom, Ian Gibbons died. He never had to answer the question. Neither, in many ways, did the company he worked for.
He was the one person in that building who might have ended it early, and he didn't make it to the stand.
It started with a newspaper. October 2015, John Carreyrou at the Wall Street Journal publishes a story that Theranos has spent years trying to prevent. It says the Edison device, the proprietary machine at the center of a $9 billion company, cannot do what Elizabeth Holmes has told the world it can do. That same evening, Holmes goes on CNBC and calls the Journal a tabloid. She quotes Gandhi. She says, "This is what happens when you work to change things. First they think you're crazy, then they fight you, and then all of a sudden you change the world." That morning, her company's valuation was still $9 billion.
She didn't deny the specifics. She reframed the accusation as proof of her own importance.
That's exactly right. And that reframe was not accidental. It was the playbook. Theranos hired David Boies, one of the most prominent lawyers in the country, the man who argued for Al Gore in Bush v. Gore. Boies sent legal threats not just to the Journal, but to individual sources. Tyler Shultz, a 20-something employee who also happened to be the grandson of former Secretary of State George Shultz, was personally targeted by Theranos lawyers after he went to regulators. The company also hired a reputation management firm to scrub journal mentions from their own Wikipedia page, which violated Wikipedia's terms of use. They were not just fighting the story, they were trying to make the story disappear.
They weaponized prestige and legal access to run out the clock, the same way the technology itself was supposed to run out the clock until the science caught up.
And for a while it worked. But the regulatory cascade that followed was not something a lawyer could stop. In January 2016, the Centers for Medicare and Medicaid Services issued a warning letter saying the Newark lab posed, and this is their language, immediate jeopardy to patient health and safety. By May of that year, Theranos voided 2 years of Edison device test results. 2 years. In July, CMS revoked their lab certification entirely, and Walgreens terminated every Theranos wellness center in the country. By January 2017, the last blood testing facility had closed. In September 2018, Theranos dissolved as a company. 13 years. Gone.
When CMS says immediate jeopardy, that's not a bureaucratic phrase. That's the most serious designation they issue.
It is. And it only came after a journalist forced the issue into public view. The regulators did not find this. They were pointed at it. The federal criminal indictment came down in June 2018, 9 counts of wire fraud, 2 counts of conspiracy to commit wire fraud. The government alleged 2 separate criminal schemes, one targeting investors, one targeting doctors and patients. The core of it was that Holmes had raised more than $700 million by making claims she knew to be false. Among those claims, and this is documented, she told investors that Theranos had generated $100 million in revenue in 2014. The actual number, according to financial records introduced at trial, was approximately $100,000. She was off by a factor of 1,000.
Did anyone ask her to verify those revenue figures before writing a check, or was the whole investor class essentially operating on her word?
The evidence suggests the latter. Theranos used non-disclosure agreements aggressively, staged controlled demonstrations for potential investors, and constructed at least one fake lab setup for a visit by Vice President Biden. Investors were shown what the company wanted them to see, and when they asked questions, they were told the technology was proprietary. Holmes also personally forged letters. This came out at trial, and she admitted it on the stand, forging letters from Pfizer and Schering-Plough claiming those pharmaceutical companies had validated Theranos' technology. They had not. She fabricated the endorsement of 2 Fortune 500 companies and put their letterheads on documents she created herself.
So when a board member or an investor asked for third-party validation, she handed them a document she had made.
That is what the evidence showed. And then there was the question of what happened to the evidence once investigators came looking. In February 2021, prosecutors accused Holmes and other Theranos executives of destroying evidence in the company's final days, specifically internal testing data on the accuracy and failure rates of the Edison device. Holmes denied it and blamed the government for losing a database. The database contained 3 years of results. It was gone.
The record of whether the machine worked, destroyed or lost, right when it would have mattered most to know.
The trial began August 31, 2021, delayed more than a year by the pandemic and by Holmes's pregnancy. 8 men, 4 women on the jury, Santa Clara County residents. The prosecution called Adam Rosendorf, the former lab director at Theranos, who testified under oath. I found these instruments to be unsuitable for clinical use. They called former employee Erica Chung, who raised serious concerns about the accuracy of the technology while she was still inside the company. They called James Mattis, the former Secretary of Defense and former Theranos board member, who had to explain on the stand why he had lent his name and credibility to a company he never independently evaluated.
What did Mattis actually know about the science when he joined that board?
Based on the trial record, very little. The board was designed for legitimacy, not oversight. Kissinger, Mattis, George Shultz, former Secretary of Defense William Perry, former Senate Majority Leader Bill Frist, these were not scientists. They were validators. Their presence on the letterhead was the product, and none of them were charged. Holmes took the stand herself for 7 days. She admitted to forging the pharmaceutical letters. She testified that she genuinely believed in the technology, that she was optimistic, not dishonest. She also disclosed that she had been raped while a student at Stanford, and she testified that Balwani, her co-defendant, her former romantic partner, had dominated and controlled her throughout their relationship, controlled what she ate, how she dressed, how much money she spent, who she could see.
She described a relationship that would give anyone pause, but she also testified in the same proceeding that Balwani did not force her to lie to investors.
That is the precise contradiction the jury had to sit with. She claimed victimhood in the relationship and authorship of her own optimism in the boardroom at the same time. The prosecution's closing argument was direct. At so many of the forks in the road, she chose the dishonest path. They asked for 15 years. The verdict came January 3, 2022. Guilty on 4 counts: conspiracy to commit wire fraud against investors, and 3 specific counts of wire fraud against individual investor victims. Not guilty on all 4 counts related to defrauding patients and doctors. Mistrial on 3 remaining counts, which prosecutors later dismissed without retrying. One of the jurors, Wayne Katz, explained the panel's thinking afterward. He said, "It's tough to convict somebody, especially somebody so likable with such a positive dream. We respected Elizabeth's belief in her technology, in her dream." The jury reportedly scored Holmes 2 out of 4 on a credibility scale during deliberations. They convicted her quickly on investor fraud. They couldn't get there on patient fraud because, in their reasoning, patients were 1 step removed from the CEO.
1.5 million Arizonans received inaccurate tests. The jury found that their harm didn't reach her.
And that gap matters. Whatever decisions those patients made, about treatment, about medication, about whether to worry or not worry, they made on the basis of results that a lab director later voided entirely. The Arizona settlement that followed works out to roughly $3 per person. Sentencing came November 2022, 11 years and 3 months in federal prison, recommended to a minimum security facility in Bryan, Texas. Fine, $400. Restitution shared with Balwani, $452 million. She reported to prison May 30, 2023. Projected release, approximately 2032. Balwani's trial ran separately and concluded differently. Guilty on all 12 counts, including the 4 patient fraud counts Holmes was acquitted on. He received 12 years and 11 months. His defense had claimed he was merely an investor. Prosecutors produced a text message Balwani had sent Holmes that read, "I am responsible for everything at Theranos."
He wrote that himself. And then his lawyers argued the opposite in open court.
Holmes filed an appeal to the Ninth Circuit. In February 2025, the court unanimously affirmed her conviction in full. They described Theranos' promise as a mirage. Holmes petitioned for rehearing. The Ninth Circuit denied it in 4 sentences. As of late 2025, she is reportedly seeking a presidential pardon from Donald Trump. The first finding: Holmes personally forged endorsement letters from Pfizer and Plow and presented them to investors as validation. She admitted this on the stand.
She didn't just mislead people. She manufactured the paper trail she needed to do it.
The second finding: Theranos' actual 2014 revenue was approximately $100,000. Holmes told investors it was $100 million. That gap is not rounding error. That is a fabrication of the entire financial picture of the company.
And investors wrote checks based on that number without being able to verify it independently.
The third finding: the internal database containing 3 years of Edison device accuracy and failure rates, the record of whether the machine worked, was either destroyed or lost in the company's final days. Prosecutors said destroyed. Holmes blamed the government. The data is gone either way.
Which means the full scope of harm to patients can never be precisely measured.
The fourth finding: Tyler Shultz, a 25-year-old employee, reported the company to Arizona health regulators under a fake name because he was afraid of legal retaliation. He was the grandson of a sitting Theranos board member. He was the one who broke this open. Not the SEC, not the FDA, not the board, not a single investor who had written a check.
The system had every opportunity and every incentive to catch this. A kid did it instead.
The fifth finding: not one board member faced legal consequences. Not one regulator. Not David Boies, who sent legal threats to suppress a true story and intimidate the people telling it.
The people who provided the credibility that made the fraud possible walked away with their reputations largely intact.
Here is what this story actually is. It is not primarily a story about one woman who lied. It is a story about a system that was designed, at every level, to reward the performance of certainty over the reality of uncertainty. Silicon Valley had an axiom: fake it till you make it. Holmes applied that axiom to blood diagnostics, where inaccuracy doesn't mean a failed product launch. It means a person makes the wrong decision about their own body. The scientific peer review process was bypassed because Theranos operated in stealth mode. The regulatory system was gamed through false device classification. The board provided prestige instead of oversight. Investors accepted controlled demonstrations and non-disclosure agreements instead of due diligence. The legal system was used to silence the people trying to tell the truth. And when it all came apart, the sentence landed on 2 people. The restitution order is largely uncollectible. And the board members who lent their names to the fraud gave interviews and moved on.
The question this story cannot answer, and I keep coming back to it, is how many patients are still out there who made a real medical decision based on a result that was wrong and who never found out?
We don't know. And because of what happened to that database, we never will.